Good morning, everybody. Firstly, can I thank the more than 47,500 people that were tested to 8 p.m. last night. That is a very good number, and we really need to see that continue moving forward. Can I also say that till 8 p.m. last night, we had a total of 11 cases. 6 of them you already knew. The additional 5 are new cases linked to existing cases. And since 8 p.m. last night, we've had an additional 14 cases. Fortunately, all of them are linked, except for the one which is the 9-year-old student at that school we mentioned a few days ago. So can I please start by thanking our health contact tracers who've done an unbelievable job in getting on top of the cases, but also in managing to find the links between all of these cases, which previously we weren't able to do. And Dr. Chant will go through that. And was it not for the good work of our contact tracers, those links would not have been able to be established. However, health remains concerned that given how contagious the virus is, we are likely to see more cases in coming days, namely from household contacts. Previously, you may have had 1 or 2 other members of a household getting the virus, but because this is a contagious strain, we anticipate that close to 100% of everybody in a household is likely to get the virus if one person has had positive test result. We also appreciate, given the patterns of behaviour that we've seen, that many workers, unfortunately, who are face-to-face with a number of clients during the day, have also been transmitting the virus. As we've said before, the mask is an important tool, but even if you're wearing a mask and you have the mildest of symptoms, you need to go and get tested because otherwise you could be transmitting the virus. As a result, Health has made a number of additional recommendations which the New South Wales Government has accepted. So firstly, all the existing settings we have in place, every single setting we have in place will now be extended until Friday midnight next week. So previously, all the existing settings were supposed to finish on Wednesday, but now all the existing settings will finish at midnight Friday next week, so an additional week from today. In addition, there is a significant announcement I'd like to make. So in the 4 local government council areas of Woollahra, Waverley, Randwick and the City of Sydney, if you live or work in those local government areas, you need to stay at home unless absolutely necessary. The necessary reasons include if you can't work from home and you have to work outside of home, if you can't get educated at home and you have to get educated outside of home, if you exercise outside, although we don't want any more groups than 10 exercising outside, and if you need to provide care or compassion to a relative, and fourthly, of course, if you need to buy essential goods or services. So these are the only reasons we want anybody who lives or works in those 4 local government areas to leave their home. And for example, I'm captured in that. I don't live in those areas, but I work there and have done so in the last fortnight, so therefore I'm captured by that stay-at-home order. So if you live or work in those 4 local government areas, you need to make sure you don't leave your home unless for the main reasons that I've outlined just now, and that will be in place for a week. Now, we appreciate what impact this will have significantly on businesses, especially in the CBD in those 4 council areas we've announced. And whilst we're doing really well with the virus, our contact tracers are doing an unbelievable job. The people who we're interviewing are doing a great job. The advice from health is we don't want to see this situation linger for weeks. We would like to see this situation end sooner rather than later. And we are on top of all the cases at the moment, bar that one. But this is really to make sure that we can prevent further spread, prevent further dislocation, and it does help us having school holidays. It might not help parents who otherwise had plans, but it certainly helps us that school isn't there and those drop-off and pick-up points and those other points of concentration aren't there. So I'll just reiterate that the new announcements, so the new arrangements we were announcing today are all the existing places. So if you're caught up in the existing restrictions of mask wearing, those 7 local government areas, not being able to travel out of Sydney, they're all in place for an additional 2 days until Friday next week. But on top of that, if you live or work in those 4 local government areas I've announced, Woollahra, Waverley, Randwick or City of Sydney, you should not leave your home unless you have to. And the reasons to leave home are if you have to go for work or education, although we prefer you stay at home to do that. If you need to exercise outside, but no more than 10 per group outside to exercise. And also if you need to buy essential goods or services. So please don't panic buy, no need for that. You can go out and buy anything you need any time of the day. We don't have curfews, we don't have anything like that. So please know that this is in order for us to ensure this doesn't take a hold for weeks and weeks. And we believe this is a proportionate response to the risk. Again, we've done better than expected in terms of contact tracing and getting on top of all those links. But what this does is make sure that we haven't missed any chains of community transmission, and also that we don't continue, through workers in particular, spreading the virus at workplaces, because we appreciate that even though most of the cases have been in and around the southeast and the CBD, that many workers come from around the Greater Sydney area into those places, and unfortunately those workers, once infected, are passing it on to a large group of clients. And that's why whether you live or work in those 4 local government areas, we will be asking you to stay home unless for the reasons we've outlined. I'll now ask Dr. Chant to go through the specific cases and what that means, and also to reiterate the health messages she wants all of us to hear. Then I'll ask Deputy Commissioner Warboys to talk about compliance, but also to provide an update on that driver that's been in question, and Minister Hazzard also to speak about changes to the health orders to make sure that we don't leave any stone unturned when it comes to keeping the community safe in New South Wales. As we've said from the outset, if there's more we need to do, we will. If there's extra clarity we need to provide, we will. But I want to say at the outset, everybody who works in and around our quarantine system, our health system, should be and is very aware of the rules. They're in guidelines, they're in multiple information spots, but I'll ask Deputy Commissioner Warboys and also the Minister for Health to outline further what the police and the government will be doing. Thank you.
Thank you, Premier. So first of all, can I thank the community for the response to testing. It was fantastic that we saw 47,603 tests to the 8 p.m. last night. I'm just going to go through the 11 locally acquired cases, noting that 6 of those were announced yesterday. And can I just say that last night, although we were announcing those 11 locally acquired cases, all of those cases were actually linked. And I want to extend my appreciation to the work of the contact tracers who managed to do that so promptly. So there were 6 announced yesterday: a man in his 30s who attended the Christo's Pizzeria in Paddington at the same time as a previously reported case, 3 women who are close contacts of a previously reported case who works as a hairdresser at Double Bay Hair Salon. All have been in isolation whilst infectious. A man in his 40s who is linked to the West Hoxton birthday party, attended by the previously reported case linked to the Bondi cluster. As of 8 p.m. last night, there were 17 people who attended the birthday party have now tested positive for COVID. And we have additional cases today, which I'll go into. A man in his 40s from Sydney's eastern suburbs who is linked to the Bondi cluster. A man in his, these are the new cases, 5 new cases, a man in his 30s and a woman in her 30s and their child, who are household contacts of each other from the Sydney's eastern suburbs, a woman in her 80s from Sydney eastern suburbs, and a man in his 20s from the Sutherland Shire who is close contact of a previously reported case and has been isolating on infectious. Can I say that we are going to see larger numbers of cases, and I'll go on to explain what we've found through the detective work. So investigations have revealed that a person who was infectious on June 15th and 16th was the source of the infection for the Joe Bailey hairdressing in Double Bay, the Fresh Nail Salon in Westfield Bondi Junction, and the Life Cafe Bondi. And a close contact of this person then introduced the infection to the Tropicana Cafe. While it is satisfying that these linkages have been found, so that means that all cases as of last night were linked, bar one, which was the child that I mentioned yesterday. So all of the other cases have got a clear transmission chain. got significant concerns for patrons and staff of the Joe Bailey Salon in Double Bay, because we have at least 3 staff members who were working whilst infectious, and with 2 confirmed cases amongst clients so far. I expect more cases to be detected over the coming days, and I'm urging all clients and staff of Joe Bailey between the 15th and the 23rd of June to be tested and maintain quarantine as directed by New South Wales Health. I can also confirm that there were 4 cases associated with the Life Cafe in Bondi, and I'm also concerned that a case that was identified yesterday attended 2 gyms whilst infectious. People who attended the Fitness First Platinum at Bondi Junction on June 21 or Fitness First Bondi Junction Spring Street on June 22nd should check the affected times on the New South Wales Health website, get tested and quarantine as directed by New South Wales Health. So just to be clear, we've found the link that explains those unlinked cases. That person was infectious in the community on the 15th and 16th, but that then led to a number of seeding events, and then we have seen workplace transmission at the Joe Bailey, and what we're concerned is the over 900 clients that attended or that potentially are at contacts may acquire the infection. Now, we have reached out to those individuals, and what I'm hoping is that when we see the cases over coming days, they're all in isolation. But the key issue is, because of the growing number of venues, the fact that we've had confirmed transmission at a number of the venues, we need to reduce people's movement, so by the time we're getting to them, they have had reduced the limited number of activities or sites that they've done. So hence the basis of the advice today to government to extend those stay-at-home directions to those 4 local government areas. So then, if we take it to overnight, what has come through, there's 17 locally acquired cases were notified overnight, and these will be included in tomorrow's numbers. 14 cases are linked to known cases. 3 are under investigation, but I can confirm that those 3 cases also are in southeastern Sydney residents. So we would expect that one is a Bondi resident, one is Bellevue Hill, and we're expecting that those linkages will be made, or hopeful that they will be made later today. But in relation to the 14 cases that are linked, we've got 2 cases linked to the Joe Bailey, and one also attended the Bondi Royal. We have got a person who had lunch at the Life Cafe, 3 people associated with the Life Cafe exposure. And then we've got 7 additional cases associated with the party in southwestern Sydney. So you can see the incredible attack rate we've had amongst guests at that party. And as we're working through this, because that party is some distance, we're hoping that everyone was fully in isolation and therefore pose no further risk to the community. At that time, it is our usual process to double check the security of all of those isolation procedures when we have any positive detections. There were also 2 close family contacts of a previous case in Bondi Junction, and that reflects the finding that we are finding household transmission, which we've always known is a highest risk, but we are seeing that very commonly. We would generally see between 30 to 40% of household contacts, but that rate is being much more increased amongst close and family contacts. And as I indicated, we've got those 3 cases under investigation, all related to southeastern Sydney at this time. We have obviously been very concerned about any seeding events, particularly establishing the seeding into regional areas, and hence can I reiterate the advice that those 7 LGAs are not permitted to move outside Metropolitan Sydney. Can I also indicate that the rationale for including the stay-at-home order to follow the workers is because we know that many of the workers do live outside those geographical LGAs, so we want them to follow those stay-at-home area orders. So again, we don't establish seating in southwestern Sydney and Western Sydney. I got a question yesterday about my concern level about those areas, and yes, we have had the southwestern Sydney party that has led to a significant transmission, but that was promptly identified. Whilst some people were infectious in the community for a period of time, but we are closely monitoring that situation, and we want to make sure that we prevent any other seeding events in that in southwestern Sydney and Western Sydney in particular. Thank you.
Thank you, Dr. Chan, Premier, Minister. Overnight, 7 infringement notices issued to people who chose to go well outside the mask-wearing order. I want to say today that police will continue to be vigilant on our transport system, on our roadways, in shopping centres, hotels and clubs. People need to understand that there is days to go in terms of compliance, and police are willing and able right across the state, and in particular in the areas in and around Sydney, to make sure that people comply. The majority of those infringements last night were on the transport system, and of course that is one of our most vulnerable places where people come together, and it doesn't matter whether it's on a train or a bus, it's around the platform, it's at those bus stops or shared areas where people wait for public transport. It is really important that people understand that our Traffic and Highway Patrol are also engaged in an operation, and they're well aware of the public health orders to make sure, especially leading into the holiday time, that people don't travel when they should not travel. It doesn't mean there will be roadblocks. I want to make that really clear, but as police go about their normal duties, they will be stopping cars, and they will be asking, and people will produce licences, and where there's a need to take action, police will. The mask wearing, $200 on the spot fine, breaching public health orders, $1,000, and of course people can be put before the court if they continue or persist in those offences. Yesterday we spoke about the investigation into the driver. That continues. I can tell you that WorkSafe are involved in that investigation now. They've been briefed on it. I can tell you that an expert in that transport area is also assisting the police investigation. And indeed, yesterday, Commissioner Fuller engaged a senior counsel to again review the advice that we have and see where other offences may have been committed and could assist the investigation. I would hope that we would have something more on that in the coming days. But what's also clear is that as police go about the investigation, they look at CCTV where it's available, that the vast majority of transport drivers have complied not just with the guidelines but also the health order. So that's very encouraging, and those drivers who have actually seen and understood and abided by their responsibilities, not just on the health order but the guidelines, we thank those people for that.
I just want to first of all start by thanking the 6,500 or so workers that put themselves forward to do a job that most people wouldn't want to do, and that is to be doing and looking after the quarantine arrangements and the transport arrangements from our international airport. Stress, we do seriously thank all of you for the work you do. Without reflecting on any individuals, it would appear that there may be a small number of people who don't comply with the expectations, the guidelines that have been set under the public health order framework. That's disappointing. We've been on this journey for 16 months, and by far the majority of our community comply with the orders, and they comply with the guidelines that are set under those orders. We will, though, now be having orders that will be effective as from 4 p.m. today, requiring that people comply with those guidelines effectively. We're stepping up the guidelines on mask wearing for those drivers of people coming in from international flights, whether they're passenger flights or whether they're cargo flights. There are crew obviously involved. There's transportation of passengers in some cases, and we will have the guidelines that have existed will be now pushed into very clear orders with very clear consequences. I have to say this though, that I think we also have to recognise that it's very hard to make a law against stupidity. No matter what we do, people have to actually apply some common sense, and they have to understand that we're living in a pandemic that's killed almost 4 million people across the world. So I'll point out to for those drivers that would mostly be aware, also to the broader community, there has been saliva testing arrangements at the airport now for many months. Any driver could easily, when they're out there, have a saliva test. In fact, I think there's been over 20,000 of those vaccines also given in the vaccine hub at the airport. So there's been a lot of work done to encourage drivers of international visitors, whether it's air crew or others, to be able to do things easily, to get your saliva test easily, get your vaccine easily, but it would appear that perhaps in some cases they haven't taken that opportunity. I also want to point out, off the back of some recent media, that even those drivers who are over 60, people who are over 60, have been able to have the Pfizer vaccine because that's what's been available for those who work in the quarantine system, and that's been in place now for a long, long while. So there is no excuse for not having had and complying with the guidelines. When these orders are in place, when there is absolute clarity through these orders, I just want to point out too that for an individual, a maximum penalty will be 6 months imprisonment and a penalty or a penalty of $11,000. So whilst we can't legislate, whilst we can't make laws against stupidity, we can actually remind individuals who are not inclined to keep themselves and therefore our community safe that there are some very substantial penalties, and the police, as we've just heard, will be seeking to enforce penalties as soon as humanly possible. Thank you.
Minister, the mask wearing for people who are in regional New South Wales who've been to Sydney the last 14 days, can you explain the type of settings that would be appropriate and why you've introduced that new order?
Sarah, I might actually allow Dr. Chant to explain the health aspects of that.
So the idea that if people have escaped, the risk period that we've had is from the exposure of from the 12th to the 13th. So we believe that was particularly, sorry, so used to wearing masks now. Apologies, and you are exempt when you have to speak in these settings. In terms of the risk period, we believe that there were exposures obviously on the 12th and the 13th of June, and around that period were when people that initiated the outbreak or the transmission were out in the community. So we take back that 14 days, which takes us roughly back to that period, and we know that if you've left the area since 14 days and haven't become unwell, then you're unlikely to have COVID. So for that reason, we're just asking, as an additional precaution, we do not want to seed our regional areas. I should say that we've had a sewage detection in Bourke, and we are now testing and trying to find the source of that. But our strong preference is not to have any seeding events, and so we ask everyone to cooperate. And we're also talking about the ski fields because of the particular unique risks in very close proximity indoors. We would ask that people wear masks indoors in the ski fields, and we would also ask that if you've been in those areas, please wear a mask.
Premier, the residents of New South Wales have been very compliant, majority, for the past 18 months. The two most significant outbreaks we've had this year were the Northern Beaches cluster and this Bondi cluster. which were both really loopholes in policy created by your government. How can you assure the community that there won't be loopholes going forward?
As I've said from the outbreak, no matter how good your systems are, no matter how good your contact tracers are, in a pandemic things are evolving, and we will find circumstances all the time where, for whatever reason, people aren't following the guidelines we've put in place, and we need to go that step further.
But in this situation, there weren't guidelines.
There were fact sheets, there were guidelines on mask wearing, on what was required. Everybody in and around the system should have had those made available to them, should have read them, should have understood what was necessary, and also applied common sense. These guidelines and fact sheets and announcements in and around our system have been in place for a significant period of time. Unfortunately, on this occasion, for whatever reason, which the police will get onto, that wasn't followed, and that's why the Health Minister has taken that additional step to make it not just abundantly clear, because the clarity is there, but also make it enforceable and with penalties. And again, can I make this point? I want the citizens of New South Wales to know that all of us need to come together to make sure we get on top of the outbreak that's before us. But I also appreciate that there'll be things that come up in the next little while that none of us had anticipated, and we will have to react and respond. We're not ever going to pretend that what we have in place is enough or what we have in place is perfect. Far from it. But what is really important is that if we do find a situation we need to fix, we find a set of circumstances we need to deal with, we're not afraid to do that. In fact, we will do that to keep our community safe and to make sure we keep our economy open as much as possible.
Do you want to run through for businesses what the obligations are for businesses in the eastern suburbs who can remain open and can't?
Yes, certainly. Well, the health orders will specify in detail, but clearly if you are a business in those 4 local government areas, unfortunately, unless you're providing essential food and services, that is takeaway food and services or grocery services of that nature, we don't expect those businesses to remain open in the next week. Now, I appreciate this is a blow for businesses in those communities, but we've been able to limit it to those 4 local government areas, and that is our intention. This is to make sure that we don't have, as Dr. Chant often says, grumbling cases of transmission going on for weeks and weeks. Our aim is to be proportionate, to restrict or to limit the stay-at-home orders to people who live and work in those 4 local government areas, and it will have an impact on businesses. But at least it doesn't impact large-scale businesses outside those 4 local government areas. So for a business like a gym in those 4 local government areas, we're saying only exercise outdoors up to groups of 10. That means obviously any gyms or indoor exercise places won't be open, nightclubs and things of those nature. Specific details will be available in the health orders, but I think people get the drift because we've been down this path before. Essentially, if I could just make this point because it's important, if you live or work in those 4 local government areas, you should only leave home if you have to work and you can't work from home, if you have to get educated and you can't get educated from home, if you need to look after someone, if you need to exercise outdoors, or if you needed to purchase essential goods and services.
So if you're residents in these local government areas, you are in lockdown?
Well, essentially you're in stay-at-home, absolutely, and I'm in that category. So doesn't matter where you live, if you happen to be usually working in one of those 4 local government areas, you have to adhere to the stay-at-home, because and the reason for this is, as Dr. Chant explained, unfortunately in this outbreak we've seen too many examples of workers coming in from other areas, getting infected in the workplace, but then passing on the infection to multiple clients. And that is, without being specific, it hasn't just happened in one instance, it's happened in multiple instances. But what it means is, for example, if you live and work in Western Sydney, you're not impacted, you adhere to the current regular restrictions. But if you live in Western Sydney and work in one of those 4 LGAs, well, obviously you're impacted and it applies to you.
About what you're doing in regards to calling a lockdown. These people in these 4 LGAs are not allowed to leave their homes unless they have, for those 5 essential reasons.
Yeah.
Is there a reason why you're not using the word lockdown?
Oh, you can use whatever word you like, but what is really important is for me to explain to our citizens who is directly impacted and what our citizens can and can't do. And we are making sure we get that information out. And I just ask everybody to come together and apply it. It's a very proportionate response. We've chosen not to do the stay-at-home orders in a broader area. But as I say, every day we get data, every day we look at situations. If there's a sudden turnaround and there's a massive improvement, well then health will provide us advice accordingly. If the opposite occurs, health will provide us advice accordingly. We always make decisions based on the health advice, and this is the best health advice, and I believe a proportionate response to the risk that's posed. I do want to stress the pleasing aspect that overnight there's essentially, I mean, Dr. Chant mentioned a couple of cases under investigation, but they've literally come in the last half hour. They're literally very new. But aside from that one child at that school, all the other cases have been linked. Now that is an amazing achievement. So our challenge is to make sure that everybody that needs to be isolated at the moment is, and to accept that we're likely to see more cases in coming days, given how contagious the virus is. So we expect two things. We expect a number of people already in isolation to develop the virus. We expect household contacts to develop the virus. And of course our aim is to make sure we get on top of any potential spread, and that we also get on top of any chains of transmission that our testing hasn't picked up, and that's why it's really, really important to have those high levels of testing.
Premier, just to make this really clear, I'm not trying to make it more convoluted, I'm just trying to figure out. So if a person who lived north of the bridge was in the city yesterday working, or in the city this morning, do they then return home to their place north of the bridge, and do they treat this like a lockdown? Yes,
if you are essentially someone who usually works in one of those 4 local government areas, especially if you've been working in those 4 local government areas either part-time or permanently in the last 2 weeks, you are subject to the stay-at-home order. So it doesn't matter where you live. If you've worked in those 4 local government areas, you're subject to that as well, and that includes me. I don't live in those 4 local government areas, but I work in the CBD on most days. Therefore, I am subject to those restrictions. I can't leave my home, and that starts today.
And that's even if they wanted to work from home from now going forward?
Correct, because the concern is, and just to explain why that is, and I'll ask Dr. Chant to repeat it to make sure that I'm clear. The reason is that a number of what we call the seeding events or the transmissions have occurred because people who might be working in a venue in Bondi, for example, or Southeast Sydney or the CBD have come into work. They've potentially got the virus from a client, and then they've been infectious while they've kept working and passed it on to other people. So we know that it doesn't just matter where you live, it does also affect where you work. And unfortunately, as a worker, you can get the virus from someone who lives somewhere else and then pass it on unintentionally to your clients. Unfortunately, we have seen a number of examples where workers have been working whilst they're infectious for a number of days. And please note, even though you're wearing a mask, it doesn't mean you don't pass the virus on. The mask is only the 4th line of defence, as we say. But if you have the mildest of symptoms, if you think you've been exposed, you have to go and get tested and isolated until health gives you further advice.
What are the rules on visiting partners, visiting family members? Are there any guidelines about that?
Well, obviously, they remain consistent to what we've applied before, but I will ask Dr. Chant to elaborate as well.
Okay, so the concept of the stay-at-home orders, and I think people will be familiar with that, it's the 4 essential reasons. We do allow outdoor exercise, and we encourage people to actually get outdoors and take advantage of that. We're allowing them to be outdoors in groups of 10, up to groups of 10, and we really encourage that because we understand the impact this is going to have. We ask people to work from home if they can, but essential workers need to move around, and that's under any restriction regime. But we ask that you work at home if you can. You are then permitted to buy essential goods and services. We're not limiting the times or of the days that you can do that. You can access healthcare as required, and can I stress clearly that there is no barrier for you to go and get a vaccination and seek medical care. It is important that you check the website and we are asking that when you go into health facilities that you are also wearing a mask. And certainly please get vaccinated. This does highlight the fact that we are in a very challenging period, and the higher vaccination coverage, the additional defence we've got to the outbreak.
Dr. Chan, just in relation to my question about family.
Okay, so
Partners don't live with each other.
yes, so we always have some components which are around intimate partner visits, and that will extend in this circumstances. But we are actually asking the community to work with us. Our contact tracers have been getting on top of the venues very quickly, but we're still just seeing some people that are infectious in the community for a period of time. And this will allow us as almost a circuit breaker to give us that time. As I said, we will assess every day, and I provide my advice to the Premier. So the sooner we can get those testing rates, the sooner we can assure ourselves that everyone's locked down and we start seeing all of those cases. Now, the case numbers are going to increase, and so the community, I would ask, and maybe we need to be clearly reporting this, is different numbers, because where cases are going to arise where people have been totally in isolation for that full infectious period, they pose no risk to the community. And so just for the community, I expect the numbers to be high. As I've said this morning, it's 17. The first thing I will ask my team is how many of those cases were already in isolation and therefore posing no ongoing risk. And so I do ask the community to see the numbers, but also we will separately report those so the community has a sense of where we're at in the response.
Yesterday, what changed? You said a 3-day lockdown doesn't work. This is only 7 days. You said that the contact tracers were on top of things. What's changed?
So I think, as I said, we look at the number of cases coming in and the fact that our exposure list is getting longer, and the fact that we have got confirmed transmission at some of those settings. So, for instance, we know that some of those exposure venues we have transmitted, and additional information came in. Obviously, the 17 cases overnight.
But all of those are in isolation.
No, I'm not saying all of the 17 are in isolation. I haven't provided that information. We're still getting that collated.
Most of them?
But that would be my hope, but we need to work through that. Literally, we knew that last night a number of them would have been in isolation, but we need to collate that information. So for me, the issue is that these exposure venues, the quickest way we're going to bring this under control most quickly is by taking this course of action. Otherwise, we risk threads establishing and that we grumble along. And so the assessment I've made is that providing this advice to the government about this period of 7 days, given the information we've got contextually, is a proportionate response. If over the next 3 or 4 days we see that the situation is much more promising, we certainly will be providing that advice to government. And I update the Premier and the Minister many times a day on concerns.
Dr. Chan, New South Wales Parliament House was included in the list of close contact venues last night. Have there been any additional cases that have been linked to New South Wales Parliament House on Tuesday?
No. So in terms of the close contact venue, can I just make it clear that the close contact advice was in relation to a venue at Parliament House, the Strangers dining room, and it was for those people where we hadn't already assessed them individually as not having been there for the whole period of the event or having accrued that close contact status. So there were a number of people, a small number of people, who made momentary entries into that room who will probably be and have been captured as casual contacts. But for the abundance of caution, because we want to make sure that we lock down people as early as possible, that text message was sent out. We are clarifying and working with everyone individually to confirm their status, but we generally send that broad message out and then we narrow it. We are working through the complexities of the workplace at Parliament House and assigning people as either close, casual or no contact. And we are working, and thank you for the cooperation of the Parliament House staff and the parliamentarians.
Dr. Chan, can I just ask, for the past 18 months, New South Wales Health has provided the 24-hour totals in the same way, but it does seem that the messaging around new cases, this outbreak is being reported really differently, which is creating quite a bit of confusion in the public. Why have you decided to do that?
Often because there's been a number of venues associated with new cases, and also because we have had a very much a transparent communication. So often in the context of outbreaks where they're growing in numbers, we feel it's important to give the community that up-to-date information. I think you've raised the issues of how we present that information so that the community can be best assess it. And as I said, from tomorrow we'll make it very clear the numbers where people have been in isolation for their full infectious period. And I ask the community to particularly focus on the number where we have had people that are not in isolation for their full infectious period, because that is the group that proposes a risk for ongoing transmission and that we're looking at.
While you're still there, sorry. Have we been able to definitively link this limousine driver who health authorities believe is the original source of this outbreak? Have we been able to definitively link this person to the air crew or whoever they were transporting?
No, we have not been able to definitively link this, and we are unlikely to do so. So if I just explain that aircrew that come in, that they are transported to quarantine hotels, and we test the aircrew on coming in. Obviously aircrew depart, and when I mean aircrew, it's not only domestic, it's freight, and New South Wales has over 3,000, I think, aircrew coming in every week. So it's actually quite a large proportion, and they're often on rapid turnarounds, and they have requirements under CASA aircraft things around periods when they can't be contacted, etc. So they go to the quarantine hotel, we test them, and we test them not with the salivary tests. We use the most sensitive test, which is the nose and throat swab, and then they, if they are then designated as close contacts, in some cases we prevent them from leaving. So those are the standard precautions. So because of that, if for instance a flight crew member stayed for 3 days and then departed, or as I said, what your status is in the morning may not be your status in the afternoon. So what we're thinking of is that some of these flight crew have become positive. Now we have reached out to the companies that this gentleman was involved in transporting the flight crew for, and asked them whether they've had any people diagnosed with COVID. But as you know, our situation in Australia is fairly unique. We try and find and diagnose every single case. That is not the setting in many other countries. And so there is a chance that this person, will never recognise that they had COVID. They might have just put it down to a mild sore throat. I don't think in any other country the messaging around, a scratchy, itchy throat deserves a swab is the same. And so because of that reason, we therefore can only hypothesise that that's the most likely route. We know that the strain is similar to strains that have been uploaded in the US, but as we know, these strains move around, so we can't be more definitive than that, and that's this sort of epidemiological aspect of the investigation.
Mr. Warboys, can I just ask about enforcement? I know with the Northern Beaches you have police sort of at the Spit, Waco's Parkway. You're going to have similar sort of enforcement, Anzac Bridge, down to the south near the airport and that sort of thing?
Yeah, we've made it very clear to police district commanders and area commanders and also traffic and highway patrol that the tasking of their police needs to reflect the public health orders, and that will not just be in and around Sydney and the 7 LGAs and now the 4 areas, but what it will be is right down to the Snowies. It will be up the Princess Pacific highways, those areas just out of Sydney, out past the Blue Mountains. So people can take it as granted that we absolutely will have our police out and about. And if people choose to go outside the public health orders, it's really clear. I think the information is clear. It is out there now, approaching the school holidays. Make sensible decisions. Stay at home if you have to. If you don't need to travel, don't do that. If you get pulled over by the police and get a ticket, there's really no excuses for it, and there isn't a lot of sympathy, I'd suggest.
Are you expecting an exodus this afternoon? Like this comes in at midnight tonight. Are you expecting everyone in the eastern suburbs, school holidays, chuck everything in the car and get going?
Yeah, look, that really is obviously something that we would factor in leading up to the school holidays. We've already had some schools have already started school holidays, so those sorts of things are certainly at the front of our mind. The other message I think it needs to be really clear is that there are other people who will enforce these public health orders or in fact seek compliance. So the people that work on train stations, bus drivers, people who work at receptions, at buildings and inside those cafes and areas. People need to respect that those people also are trying to do the right thing and heed the advice. Thank you.
Can I just, Deputy Commissioner Walbers, can I also just remind everybody that for a number of days now we've had in place that people who live and work in those 7 LGAs aren't allowed to leave Sydney anyway. So there are maps available as to what is Metropolitan Sydney. So I just want to remind everybody that that's still in place for another week. So we've already identified earlier on Monday the 7 LGAs where if you live and work, you can't leave Sydney. Now that stays in place. Can I be very, very clear about that? We do not want this virus spreading to the regions. That's why we've already put in mask wearing for some of those regional communities and also some of these restrictions in other communities where the virus has been circulating. But can I make it clear that for a number of days now, nobody who lives or works in those 7 LGAs has been allowed out of Metropolitan Sydney. That stays in place, of course. But now what we've got in addition is that extends for another 2 days, and also that those 4 LGAs we mentioned, you can't leave your home unless absolutely necessary for those 4 reasons or 5 reasons that we outlined.
Why did it take authorities 3 days to warn residents in the Bondi Limo drivers block that a couple in the building have COVID-19? New South Wales Health warned those residents on Saturday night. He was diagnosed on Wednesday. What took the health department so long?
I will just have to go back over the timelines for when the interview was completed and the assessment made in relation to that venue. So happy to take that. Look, can I say that we assess the priority of different venues. I'm not familiar with the nature of that apartment block, but I do believe that it's a small apartment block in the 9. And I'll get you the timelines for the contact. But can I just say, New South Wales Health endeavours to, and I had a question earlier about why are we giving you the numbers every morning to update you. It's because we want to explain to the community that when there are new exposure sites, that they link to the new cases that we've got that day. So we do our best, and we're happy to be accountable for those.
Just on that Limo driver, the Nine Network last night said that they've spoken to that driver. He claims that he got the virus while sitting at Bell's Cafe because someone sneezed on him. What do you make of that? And your comments earlier that there is no definitive evidence that he is patient 0. Do we know that the limo driver is in fact the cause of this outbreak?
So in terms of, I think I've been very clear what we know and what we don't know at all times. Obviously at the beginning, when we have a diagnosis in someone who transports flight crew, I think it's reasonable that we would make that assumption, and that's probably on strong epidemiological grounds that is likely to be the hypothesis. I think I've stressed that throughout COVID you have to keep an open mind to all different ideas, but that's certainly the advice I've had. It's consistent with that being the most plausible, but as I said, I'm happy to work with that gentleman if he's got other rationale for that. Can I also just say one other thing, which is very important and will give some relief to a number of individuals, that remember the case we had from Borkham Hills case? Yes. Okay, so as we had said, that gentleman, the expert panel unfortunately could not rule out that was whether that was a false positive, an old infection or a new infection. We undertook, and the expert panel advised that we needed 7 more days of serology, and that's the blood test to see if you have been exposed and you mount an immune response, because he had very low levels of the virus, and the question was as to had we got him at the tail end of his infectiousness, but that he might have historically been infectious or in that recent future. He had repeat blood testing, and I can confirm now that the man in his 40s from Sydney's northwest, first reported on the 18th of June, has now been officially ruled out following further testing at a new expert panel convened yesterday, Thursday evening. And can I thank the person for their cooperation in undertaking a range of comprehensive testing to understand the timing and nature of the reported infection. We'll remove that case from our numbers, but most importantly, we'll also be reaching out to anyone to make it clear that that was not a case if people have been impacted by that. And can I thank the community who we were very clear that we were needing to work through that, and thank everyone who isolated appropriately associated with that case. We really appreciate it, but at these times it's very important we take a cautious approach.
Minister Hazard, can I just ask about, you're about to lock down a couple of million people in Sydney, and there's a lot of people who are asking the same question. What is going on with the vaccine right now? Are we any chance of getting this thing up and going properly?
I can only say that the New South Wales Government and the New South Wales Health is doing absolutely everything we can to get the vaccines out into people's arms. But to some degree, our arms are tied behind our back when there's just insufficient vaccine supply to be able to get it out. That remains the ongoing issue.
Governor Walker,
Last question, please.
Can I ask you about the machinations of government? You've obviously
Machinations
got
of what, I'm sorry?
Government.
Oh,
Sorry,
right, yeah.
You've obviously got ministers in
Yeah.
isolation. You're going to have to go home, you've said yourself.
Yeah.
How are you going to do your job?
Yeah, can I just stress that as far as work from home is concerned, it's obviously if you have a job or responsibilities which don't allow you to stay and work from home, you are able for essential work purposes to leave your home. So I want to make that clear. Generally, and more broadly, I think all of us have to adjust to virtual workplaces as well. So whilst a number of workplaces will have some people at home isolating, will have others working from home, there are still opportunities for everything to function, and that's why in New South Wales we're very keen to make sure that we allow people the opportunity to work around the health advice we've given. So in essence, the health advice we've provided, the stay-at-home requirements for particular geographic regions apply. However, if you have a job which requires you to leave home and you live in those local government areas, well, that's understandable. And we, to an extent, allow people to revert to common sense and be sensible about it. But if you have a job, you can't do from home, and that's always been the case. Even when the previous stay-at-home provisions were in place, that was the case. But also, I'm pleased to say that. Not that it's a benefit, but having lived with COVID for 16 months, many workplaces have adjusted to having some staff on site, some staff from home, and depending on the geographic location of those workplaces, I think people can adjust. Of course, it's always our government's intention for as much as possible for work and economic activity to continue. So if you are able to do that, you should do so, but obviously within those health requirements.
So
Why is it?
I'm sorry?
What are the complexities that?
Well, Parliament was in winter recess now anyway. We don't go back till August, so that's not an issue. Well, obviously we'll work around that.
So what are the complexities and why is it inconsistent that some ministers are close contacts and others aren't?
Oh, can I just say that is based on the health advice. I'll ask Dr. Chant to explain. But also, please know that for every event that occurs, every transmission that occurs, health goes through hours and hours of evidence, CCTV footage, to make those assessments. So I'll ask Dr. Chant to expand on that.
So what we need to do is we interview, I'll just go in terms of generics. We interview the case, and the case indicates his movements, what meetings he attended, who he recalls having conversations with. We then contact those individuals as priorities because the case himself has indicated that that's who he is most concerned about in terms of the duration of time. There is also a factor that because this case was actually picked up very close after the exposure, so just be clear, the exposure event we believe this gentleman was infected occurred on Monday night. And so the expert panel that reviewed it said whilst he was infectious on Tuesday, it's very unlikely that he was infectious before 7 p.m. on the Tuesday, but it can't be excluded. But it proportionately throughout the night and into the morning, his likelihood of being infectious, but even then mildly, increases. And so what we need to then do is figure out who's been a close contact, but also adjust it for instance, in the morning at 7 o'clock, even if you had a conversation with him from a distance, that would be still potentially very low risk because he wouldn't have had time to become infectious. So we're working, so you can see there's complexities. Our public health clinicians have reviewed CCTV footage. We're looking at the layout of various rooms and then looking at video to see who sat around him and using multiple methods to triangulate it. Could I just say that it's sometimes complex to remember who you talked to or who you spent time with, so we do use multiple sources of information, and that is why it's complex. Thank you.
Do weddings need to be cancelled this weekend? Do weddings need to be cancelled this weekend? If someone's having a